Hello, I'm Dr. Ken Landa. Thanks for watching. Let's talk about alcoholic blackouts. It's a form of amnesia. It's when you drink and you lose the ability to remember what happens while you're drinking. You can't make new memories. And that's because of the way alcohol works on the brain. Typically, these people look and act otherwise normally. It's not associated with a loss of consciousness. It's not associated with how many years you've been drinking. It doesn't indicate chronic alcoholism. Alcoholics may or may not have blackouts. It doesn't indicate the presence of liver disease. It's completely different than the term. You would think the term blackout means that you've passed out or you've fallen asleep. That's not what an alcoholic blackout is. Your eyes aren't closed. You're not dead to the world. During an alcoholic blackout, you're awake and you're functioning, but you just have no memory of what you're doing. And unfortunately, the situation remains extremely common even to the people who suffer from alcoholic blackouts. People who have alcoholic blackouts, unfortunately, are normal externally. You can't identify a person who's having an alcoholic blackout. There's no objective evidence. They don't have any slurred speech. They don't have any blurred vision. They're not your stereotyped image of a drunk. They actually can carry out mundane and harmless activities. They can converse or laugh or tell stories or dance or participate even in emotionally charged events. But unfortunately, they can engage in dangerous activities. They drive a car. They engage in fights and arguments and gamble and spend money. They can unintentionally use drugs. They have impaired decision-making. They can't assess the potential dangerousness of a situation, so they're more likely to try illicit drugs. They have a tendency to act more impulsively. They're more unguarded. They're more exhibitionistic. They're more sexually aggressive. But all the while, these people look and act otherwise normally. They're incapacitated as far as giving consent for sex, yet they frequently engage in sexual relationships while they have alcoholic blackouts. Engage in sex with acquaintances or with strangers. They're at risk for sexually transmitted diseases. And interestingly, many of the so-called date rape activities were actually activities that occurred while a person had an alcoholic blackout, which raises significant legal issues and certainly puts women at risk. And unfortunately, if you have one blackout, chances are you're going to have another blackout and the same situation is going to occur. Alcoholic blackout. Well, you tend to awaken in a strange place with a strange person. Men have a tendency when they have alcoholic blackouts to do things to others. So they awaken with either bloody knuckles or bruises. They don't remember assaults or fights or vandalism. They oftentimes wake up in jail. On the other hand, women have things done to them, and then they worry whether they acted dumb or weird. But remember, during an alcoholic blackout, all of the time, you have no memory of what happened. You can't find your car. You have no idea to where you got where you were when you awakened. How come you were dressed in these clothes that aren't even yours? And you have impaired judgment. So during the alcoholic blackout, you're probably going to drink more. A clue to an alcoholic blackout is a person has a tendency to repeat themselves. And you can imagine how difficult it is in a relationship when one person has a history of alcoholic blackouts and is defensive and confused, and the other person is hurt and resentful of what happened. Well, alcoholic blackouts occur suddenly. It's not a graded phenomenon. It just doesn't slowly occur. It's kind of like if you have amnesia after a head injury. You just don't remember. Well, with alcohol blackouts, you have no memory of the event. They come on suddenly, and there are two types. There are two types. One is called fragmentary blackout. The other is called en bloc blackout. Now, a fragmentary blackout has a distinct onset and a distinct offset. It has a relatively short duration. It lasts for minutes to hours. It's a deficiency of encoding. You can't encode short-term memory to long-term memory. And the episodes seem to occur because of your individual tolerance or your genetic factors or your metabolism. They tend to recur And other people who have the same blood alcohol level might not have the alcohol blackouts. They're also known as brownouts or grayouts. Remember, you have a loss of short-term memory brought on by drinking. It's just like somebody pulled the curtains and you don't remember what happened. You don't remember what happened until somebody reminds you of what you did. Maybe when you awaken in a strange bed or with strange clothes, you're eating a pizza, you don't know where it came from, you can't find your car. And in fact, memory with fragmentary blackouts tends to be hazy or spotty. And you can reconstruct it oftentimes with cues, either environmental cues or video from a cell phone that a friend took or assistance from friends. Fragmentary blackouts are much more common than en bloc blackouts. They're about 3 or 4 times more common. They occur with a lower blood alcohol level. The blood alcohol level of people with fragmentary blackouts tends to be about 0.2%. Could be as little as 2 or 3 drinks for some individuals. The range is anywhere from as low as 0.06% to maybe about 0.3%. Remember, driving while intoxicated is 0.08%. Now, there's a greater acceptance of fragmentary blackouts than there is of en bloc blackouts, both the individual and the peer group, especially among women. The en bloc blackouts, however, you're unable to recall the details for the entire period of time. There's total amnesia for the events that occurred while you were having the en bloc blackout, and it doesn't matter if somebody shows you a video or somebody reminds you, you just don't remember. They have a distinct onset, but the offset tends to be a little less clear because oftentimes a person is asleep. A person falls asleep prior to coming out of the blackout, and then they awaken in the morning. They awaken in the morning with absolutely no memory of what happened, and they're even worse if they have consumed some sort of another drug that might have an impact on memory. So if they had marijuana, if they had an opioid, if they had a tranquilizer or a sleeping pill. And the blood alcohol level, as I mentioned, tends to be higher in en bloc blackouts, tends to be 0.3% versus 0.2% in the fragmentary blackouts. The en bloc blackouts, only 1/3 to 1/4 as frequent as the fragmentary blackouts. Now, most people tend to regard the en bloc blackouts as worse than fragmentary blackouts. And on careful testing, it appears that people suffering from en bloc blackouts may actually suffer from long-term mild neurologic disease or disorder of brain function. Now, blackouts are especially common in college-age life, fraternity parties, sorority parties, especially if a person engages in pre-party drinking or drinking games or shots or has peer pressure. Some people actually drink to excess because they want to get drunk, because they want to act irresponsibly. And actually, in some women, fragmentary blackouts are a sort of a bonding experience where they sit together the next day and they try to reconstruct what happened and with whom. But it's important to realize that most people who suffer from alcoholic blackouts aren't alcohol dependent. They're not alcoholics. But if you have one alcoholic blackout, chances are you're going to have another. And up until relatively recently, there was the concept that alcohol blackouts only occurred in alcoholics. That came from a study in 1946 with people from Alcoholics Anonymous. But over a period of the past 15 or 20 years, things have changed. It started in the 1960s and early 1970s when they evaluated people who were hospitalized for alcoholism. 2/3 of the people had a history of blackouts, and to test their memory, an interesting study was done. They drank to excess, and then they were shown an erotic movie, or they held a pan, a frying pan, that was covered. And it was covered with, it was inside was dead mice. And then it was uncovered. And the people were asked, do you remember? And they remembered immediately. They remembered even for 2 minutes. But at 30 minutes, they had no idea that they had seen the erotic movie, or they held a frying pan with dead mice. And at 24 hours, they still did not remember. Now, alcohol has positive effects. Certainly everybody thinks positively of alcohol. It's a marriage, a toast, maybe a birthday party or a sporting event. And low doses of alcohol can decrease self-consciousness and loneliness and insecurity and fear. But people oftentimes only think of the euphoric effect of alcohol. That gives you what's known as an alcohol expectancy. You expect the positive, you don't expect the negative results. Now, some women who drink, especially college women, are so frightened and embarrassed and disgusted when they have these blackouts that they markedly reduce their drinking or only drink when they can feel safe. But a significant number of people don't seem to care. Now, what do we know about alcohol blackouts? Well, we talked about the blood alcohol level, but it's more than just the blood alcohol level, because a person who drinks relatively slowly during the course of a day can attain a blood alcohol concentration of 0.3% and have no blackout, whereas a person who drinks very rapidly, very fast, can have an alcohol blackout at a considerably reduced level of alcohol. So it's not the total amount, it's the rapidity of the rise in the blood alcohol content. That seems to predispose to this condition. And it seems that either spirits or wine are more likely to produce the situation than beer. Beer, because it's much greater volume. You have to drink a lot more beer to get an alcoholic blackout than you would if you were drinking wine, which is more concentrated or even yet more concentrated with the spirits. You metabolize alcohol at a rate of about one alcohol unit per hour. So if somebody drinks throughout the course of a day, slowly, you're going to awaken with a headache and a hangover, but you're not going to have an alcohol blackout. Your memory is going to be intact. But if you drink the same quantity much more rapidly, you're going to lose your memory. The incidence in men and women is interestingly about the same. But men drink more than women. But there's a gender difference in the way people metabolize alcohol, and the alcohol is distributed inside the body. Now, women have more fat and less water than men, and alcohol itself distributes only in the water. So it's more concentrated in women. Women are smaller than men, and also women have difference in the enzymes. Men have an enzyme in the stomach known as alcohol dehydrogenase that starts to break down alcohol before it even gets into the system. Women lack that enzyme, and as a result, they're especially prone to blackouts. Blackouts tend to occur during the first few hours of drinking. The duration is 15 minutes or more with a fragmentary blackout, typically several hours with an en bloc blackout. 50% of the en bloc blackouts don't resolve until a person awakens in the morning. It's an anterograde amnesia, an amnesia for events that occur during the time, not for events that occurred prior to the time. You don't know what you did, you don't know what you said, you don't know with whom you engaged in any kind of activity. It tends to impair episodic memory, the memory of what happened, where, and with whom. There's no national database on who suffers or how frequent it is, but a study at Duke University found that 51% of the students, so about half of the students who ever consumed alcohol, had at least one fragmentary or one en bloc blackout. And within a 2-week period prior to the time the study was done, 9% of men, 9% of female students at the university had an alcohol blackout. Among people who drink when they're 15 years old, 30% have an alcohol blackout. People who drink when they're 19 years old, 75% have an alcohol blackout, and it tends to be, at least in part, because the frontal lobes of the brain don't fully mature until a person is around age 25. Well, these alcohol blackouts are frequent in social drinkers and college drinkers and high school drinkers, and the highest level of drinking tends to occur in people who are between the ages of about 15 and 22. And if we survey people in those age groups, about 25 to 50% have a history of an alcohol blackout. And if we evaluate people just in the 6 months prior to the study, about 20% have a history of alcohol blackout. And in the period between high school and college, just those several months, about 12% of men, 12% of women have an alcohol blackout. The average in college students can be as frequent as one alcohol blackout every 5 weeks. And that continues even into medical students, where the incidence is about 1 in 3, and even into people during their residencies after medical school, 1 in 3. So a common condition. It tends to occur more in younger people than in older people. Older people, we tend to fall asleep if we drink too much. It seems that alcohol doesn't have the same sedative effects in younger people as it does in older people. And there are complications associated with injuries. If you have an alcohol blackout, well, you have a 50% greater chance of being injured in the next 2 years. And if you have several alcohol blackouts, that increases to 2 to 3-fold. Now, if we follow people who have alcohol blackouts during the college years, and it doesn't matter whether you go to college or not, it's the age that's important, well, it seems that the alcohol blackouts continue for a period of about 4 years. But after a person graduates from college, when a person gets married, enters into the workforce, has full-time occupation, then the likelihood of alcohol blackouts, fortunately, decreases by about 2/3. A person is at risk because of their genetics, the way they metabolize alcohol, how they absorb alcohol, the rate of gastric emptying, the enzymes you have, the ability of your liver to tolerate the alcohol, to metabolize the alcohol. Interestingly, pregnant women who drink during pregnancy seem to imprint their offspring with a tendency to develop an increased incidence of alcohol blackouts when they get to be teenagers and into their early 20s. And remember, a significant number of women will become pregnant and not even know it, at least early on. You're more at risk if you're fatigued, or if you have sleep deprivation, or if you're using any kind of benzodiazepine, a tranquilizer, a cannabinoid, an opioid, a barbiturate. There was once upon a time the concept that alcohol killed the brain cells. That was in the 1990s. Now we've sort of changed the current thought. It seems that alcohol actually works on the way one brain cell works and interacts with another brain cell. It acts via the neurotransmitters. And it seems that the alcohol affects the lipid membranes on the cells of the brain. And that's where the receptors are. So if we look at the memory, we can have the sensory input memory or the acquisition memory. That lasts for a few seconds. It's from sight or sound or hearing or feeling or taste. And that's followed by the short-term memory, the retention memory. This lasts for seconds to minutes. And then we have the long-term memory, the storage memory. That's the memory that we need to recall events. Well, it seems that all of this is dependent on the pyramidal cells in the hippocampus, and alcohol significantly and negatively impacts them. These cells need to receive input from other areas of the brain and send it off to the frontal lobe to be stored. Well, the so-called CA1 cells in the pyramidal cells in the hippocampus, they're negatively affected by the alcohol. And those cells require the input of another area, an area known as the medial septum. And the medial septum is a gatekeeper. It allows things to get in or not to get into the pyramidal cells of the hippocampus. And the alcohol throws them off as well and throws off the frontal lobes. So this binge drinking that leads to problems, that's extraordinarily common. We define binge drinking as drinking to get alcohol concentration, a blood alcohol concentration of greater than 0.08, or it can be defined as more than 5 drinks in 2 hours in men or more than 4 drinks in 2 hours in women. And it would appear that if we look at people over age 18 in the United States, about 1 in 4 will binge drink during the course of the month. That means about 37 million people are going to binge drink at least once during the course of a week. And among people between the ages of 12 and 20, that number is still 13%. So what are the consequences of alcohol and binge drinking? Well, there are a significant number of date rapes that are going to occur. It's estimated that the number, just in college students, college-age students, is going to be 100,000. So how do you minimize your risk? If you're going to a party especially, set limits on how much you're going to drink. even 1 or 2 drinks in addition to what you normally drink, may cause an alcohol blackout. You can have a friend ask you about every 15 minutes, what happened 15 minutes before? If you can't remember, it's time for you to go home. Don't drink on an empty stomach. Eat something before you drink. Have a glass of water for every alcoholic beverage you consume. Don't drink more than 1 drink an hour. No shots, no drinking games, no pre-party drinking. And avoid drugs that interact with alcohol. The tranquilizers, the Xanax, the diazepam, the opioids. If you do that, you might be relatively safe. But remember, alcohol blackouts, you're not blacked out. You're carrying on normal activities. You're just not responsible. You don't have any memory. And you can get yourself in a lot of trouble. Anyway, thanks for watching. I'm Dr. Ken Landau.